U.S. Senator Lindsey Graham is dead, and there's a valuable lesson here you need to know.
Republican South Carolina Senator Lindsey Graham has died.
And his office said that he actually died from a tear in the largest artery in his heart.
Initial results of Lindsey Graham's cause of death and his autopsy.
Per Axios reporting, his staff told him repeatedly that he needed to go to the hospital, but instead he joked that he would go to the hospital after he did an interview. But just a few hours later, he collapsed and died. When in doubt, especially if others around you are recommending the emergency room, you should also go to the emergency room because sometimes minutes can save your life. I'm nurse practitioner Chelsea Rose, and I work in urgent care. Here are the symptoms that should prompt you or a nearby person to call 911. Sudden confusion, stroke symptoms, major head trauma with loss of consciousness or seizures, severe allergy symptoms like shortness of breath or swelling in the throat, severe chest pain or pressure, severe shortness of breath, especially if it's shortness of breath at rest, vomiting blood, major severe abdominal pain, any major trauma like a car accident, or especially if you're a pedestrian or a bike rider. These need to be worked up in the emergency room. Do not come see me at urgent care. I know going to the hospital means giving up control. You walk in with pain, and then 5 minutes later, you're in a hospital gown, you're getting poked and prodded, your booty's hanging out of those little hospital gowns, and you're wondering how much it's going to cost you. But sometimes you need a workup in the emergency room to rule out the life-threatening stuff. Comment emergency, and I'll DM you a list of symptoms that warrant workup in the emergency room, or you can email me at chelsea@uraywellness.com.